All right, we're back, and hey, got a new doctor in the house. Yes, we have Dr. Wendell Heidinger with us today. He's an MD. He's with Ventana Wellness. And let me say this before we talk to Dr. Heidinger first. Nisha, as you well know, is going to be holding a free event tomorrow night at the Smullen Center at 6:30 in the evening, and it's dealing with being tired and wired. I think we're all stressed out, right, Doc?
Absolutely.
And it produces pain?
It can.
All right, we'll talk about that. But you know, with all this high-tech stuff, we are really ratcheted up to the highest degree. So maybe you're wired and you're tired. And if you are, well, they'll be talking about from weight gain to anxiety to fatigue, memory loss, fat around the middle, insomnia, and the food, or the list of things go on. I had food cravings here too. Anyway, it's a free event tomorrow night, Smullen Center, which is next to RVMC. And it'll be 6:30. Nisha and her crew will be there, sponsored by Black Oath Health Mart Pharmacy. So we look forward to that. Well, Dr. Heidinger, nice to have you. You are, I understand, the chronic pain expert.
Well, I do take care of patients with chronic pain, correct.
All right. So what is chronic pain? Give us the simple definition of that.
Chronic pain, it's to be distinguished from acute pain. So acute pain is if you're pounding a nail and you smash your finger, that's acute pain.
Okay.
And we expect that's going to go away in a few days, and life goes on. Chronic pain, in contrast, doesn't go on. I mean, does go on, and it doesn't go away. And so we find, by definition, we're talking in the 3 to 6 month range. If it hasn't gone away by then we're starting to think in terms of chronic pain.
All right. Well, I think perhaps all of us suffer with some of it. I guess I could give you my back pain problem. We could talk about that. You know, of all the things in medicine, you're an MD. What led you to kind of specialize here?
You know, that's a good question. Chronic pain is a little bit of the Achilles heel of medicine. Nobody wants to deal with it. It's kind of a, especially in Oregon, it's a bit of a risky field in the fact that managing opioids on an ongoing basis has its share of problems, and they're not always easy problems to tackle. Many of the reasons that I went into it is, number one, I saw a need for it. Number two, I realized that nobody else really wants to do it, and so I decided, well, maybe I should help to fill that void. And a third reason is, it's very gratifying, it's very satisfying actually, to see people who are disengaged with life and basically not functioning, not doing the normal stuff, and being able to work with them, make some adjustments. Sometimes medications are needed, but to see their lives completely turned around and to see them re-engaged in life, it's a very gratifying and satisfying thing to see that happen.
Well, you're saying something that is really remarkable, that there is hope here, because a lot of people who suffer with chronic pain almost get an attitude of giving up and rely on medication.
Happens all the time. I see it routinely, and to be able to inspire hope and actually deliver on that, not in every case, but in many cases, it's a good thing, I believe.
All right. So when somebody comes in, obviously you're going to diagnose where the pain is and all these things. Do you have a goal in mind? Are you trying to get them completely pain-free, reduce pain? How do you assess that?
Well, you're entirely correct. What I do is I take a history, I do a physical exam, kind of normal doctor things, actually. And once I've figured that out, I try to make a determination, are there other avenues that we can pursue that would take away this pain? Do they need a surgery? If they had a procedure, if they had, you know, other venues, could this take away the pain? If it seems unlikely that anything else is going to help, kind of our last resort is to go to chronic opioid therapy, which has its set of downsides, but also can make a big difference. So I kind of do the history, do the physical, see what I can do to stop the pain, to fix the problem. If it's unfixable, what can we do to make it livable? Okay.
Just stepping back, broad question here. Does the industry, medical industry, have a tendency to over-medicate this issue?
You know, that's actually a national issue. In fact, I just saw something on news from Google last night, I think, where the feds, the DEA, who is it? Somebody's ratcheting down a bit more on the drug OxyContin, which is one of the chronic opioid therapies. And so yes, there's it's a national question. The reason it's a national question is actually, it's a good reason. What they found is that the number of people dying from chronic opioid therapy is increased a lot as we've treated more and more pain.
Right.
And of course, our goal is to save lives, not to lose lives. And so the industry is looking at it with a more and more and more focused eye, trying to see how can we treat folks appropriately and still avoid the bad outcomes. Unfortunately, Oregon is number 1 or 2 in the nation for this problem as far as abuse and misuse and adverse prescribing, and unfortunately Jackson County is right up at the top within the state of Oregon. So we have some challenges.
Well, that says a lot. That really says a lot. So your goal as a physician is to find other alternatives to this for treatment.
If at all possible, absolutely. We try to find other alternatives. If there are not other alternatives, then we wade into the chronic opioid therapy, you know, gingerly and gently, and try to do it discreetly and keep it to a minimum if at all possible.
Dr. Heidinger, is chronic pain primarily the result of an injury? Is that a tough one? A broad one?
That is a broad one, actually. It can occur from injury. I find very frequently people who have chronic pain have had trauma in the past. I'll put it in that verbiage.
Emotional?
Oftentimes it's emotional, sometimes it's physical. But you can almost always, if you go looking for it, you can almost always find trauma in the past. And interestingly enough, actually, if you address that trauma, oftentimes the pain level comes right down on its own.
Wow.
I'll give you an example, actually, if I could.
Sure.
I oftentimes integrate the spiritual component into my practice when it's appropriate, and if folks are interested. And I'll give you an example of that. So just 2 months ago, 6 weeks ago, something, I had a patient come to me with fibromyalgia. She was a Christian. She had a fair amount of pain, actually. Her pain scale was fairly high. She did not want medications, and in general, the opioids are not indicated for fibromyalgia. And so, as I listened to her and as I interviewed her, it became obvious to me that she was struggling with a lot of anxiety, which is one of the issues that you get into with chronic pain. So, what I did is I gave her a way of studying Scripture, if you will, that would help her to know a little bit more who God was, help her to be friends with God, actually, be good friends with God. And I said, come back and see me in a month. Well, she did. She went home. She took the assignment that I gave her. She implemented the assignment. She came back in a month absolutely ecstatic. Her pain had dropped dramatically. She was so excited. She had told her church members, she had told her friends, she had told anybody who would listen, because knowing God better helped her anxiety to drop substantially, and in turn her pain dropped.
That is so refreshing to hear. So refreshing to hear. So, if appropriate, you pray with your patients?
Absolutely. I mean, 2 days ago, yesterday, I had a patient and I asked, would you like me to pray with you? And I had prayed with her 2 or 3 times in the past, and her answer was, every time I want you to pray with me. So I do believe in the power of prayer, and I do think it makes a difference. And to incorporate that into the healing arts, I think, is actually what the great physician actually did.
You know what's so interesting about this, because I'm no physician, I'm no psychologist, but doing 30 some odd years of talk radio and listening to all of these things, you begin to see some real patterns. There's no doubt in my mind there is a connection between emotional trauma and physical health and pain.
Absolutely, I see it. I see it routinely.
And so you're one of the few that I've ever interviewed where they've come in and say, wait a minute, let's look at the spiritual component of this thing.
You know, it's disappointing to me as a physician, and I have excellent colleagues in the field of medicine. It's not very common to integrate this component, and yet it's fairly scientific. It's scientifically proven at this point.
Right.
And so I think we miss a healing component when we leave it out.
All right, we're going to have to take a break when we come back. There's a lot of chronic pain out there. I'm probably one of them with the lower back issue. Do you look to polo therapy as part of it?
Absolutely. The number of alternatives to include in that. I actually am fairly new to prolotherapy. Dr. Osborne, my colleague, does that routinely, has great success with it. So that's one of many avenues available.
All right. We'll be back just a moment with Dr. Heidinger, and he's a new physician there at Ventana Wellness, and his expertise is chronic pain. So this is the kind of pain guy you want to see. He'll pray with you. We'll be right back. Okay, we're back with Dr. Wendell Heidinger. He's a new physician, MD, there with Ventana Wellness, and his area of expertise is chronic pain. And I'm just so delighted to meet you and to hear that you pray with people and you look for the spiritual connection in people's pain. You're already hearing probably quite a few testimonies of going down that route and helping people
Correct.
there to reconsider their spiritual aspect of things.
Correct.
That's wonderful. All right, now when you diagnose something, at what point do you go to medication, or where do you go? Do you go to therapy? How do you look at these things?
Well, first of all, like I mentioned, we do the history and I do the physical exam, and then I sit back and I think about it and I say, well, what's been tried and what hasn't been tried. In most cases, we kind of, before we jump to opioid therapy, I want to make sure all other avenues have been exhausted. So if you haven't had physical therapy, it seems like a reasonable option, I'll send you to physical therapy. You know, if you need some manipulation, sometimes physical therapy will do that, sometimes chiropractic will do that. Sometimes injection therapy can be useful. That can be done by Dr. Osborne in my office or an interventional pain specialist. So there's the emotional component that can be addressed, and sometimes I'll send folks to counseling or to a psychiatrist. Treating depression in and of itself can decrease pain. I don't know if you've noticed, but when a person is depressed, everything is worse. It doesn't matter what it is. Everything is worse, and pain is worse too. So if you treat the depression, the pain is oftentimes more bearable, and their function increases. So I'll pursue every option that I can think of outside of chronic opioid therapy. If we jump into medications, then I'll first go to the non-controlled medications, and if those fail, then at that point we go to the controlled medications. Oftentimes a surgeon may get involved somewhere in that sequence to evaluate and see if there's anything they can offer.
All right, I got a couple questions here. I got to make myself a note. What about treatment of arthritis? I mean, this is chronic, isn't
Correct.
it? And sometimes it's just, I've seen people really suffer with this. How do you approach that one?
Well, there's two types of arthritis, two primary types. There's osteoarthritis, which is the degenerative and where the bones and the joints just kind of get old, if you will. The joint spaces decrease in size, and it can be painful. So that's osteoarthritis. Then there's the autoimmune arthritis, is like rheumatoid arthritis, lupus, those type of things. And those it's more an inflammatory condition where the body tends to fight itself, if you will. I don't know if inflammatory is the right word, but the body kind of attacking itself. So if you have the inflammatory arthritides and those issues, I'll oftentimes refer to a rheumatologist who is actually the expert in those fields, and they'll consider medications to help the body quit fighting itself, and oftentimes that can give a dramatic improvement. If it's osteoarthritis, then we have to look at, there's not a lot of fixes for that. It's not like I can stop that progress. And so we have to look again, well, you know, is it in one spot? Can that joint be fused by a surgeon? Is it all over? Well, you're not going to fuse all the joints of the body. Then will anti-inflammatories help? And will some of the neuroleptics help? So we use...
it can come back, can it?
What's that?
Arthritis. I mean, if you had surgery and it was scraped out, can it come back? And
well, the surgery actually tends to create it. So if you break your knee playing football in college, 20, 30 years later, you're likely to have arthritis in your knee from that old fracture.
Wow. Okay.
Yeah.
So, All right, let me ask you a couple of things. You mentioned chiropractic work, so you're a believer of that? Works?
You know, the manipulative arts is an interesting thing. I was actually trained, never ever send anybody to a chiropractor for any reason. They kill X number of people per day, et cetera, et cetera.
What'd you do with that one?
Well, you do what you do with everything. You say, does that sound right? Does that process? So, you know, I'm a normal person. I have to go to the barber to get a haircut. I have to go buy gas. I have to, and as folks would find out that I was a physician, they'd say, well, let me tell you my story.
Yeah.
And I didn't even ask for it.
Yeah.
But time and time again, I would hear, I went to the family practice doc, I went to the neurosurgeon, I went to the orthopod, blah, blah, blah. I finally went to the chiropractor, and in 6 weeks or 8 weeks or 1 month, I was walking straight, or I was feeling, which told me that there was, you know, there has to be some adjustment in the way I was taught. Since then, I have seen and I have learned that manipulation can actually improve a person's well-being. Physical therapists who use manipulation, my patients seem to get better quicker when manipulation is used. So I think chiropractic is just like everything else. In the right hands, used in the right ways for the right conditions, it can be a big benefit.
Yeah, because I've heard the same thing. All right, acupuncture.
Acupuncture, we have Duke at Ventana, who is an acupuncturist. I haven't had a ton of exposure to it. Interestingly enough, in some of my conversations with him, he says that acupuncture can help a lot with centralization. Centralization is where the nerves get, we'll try to simplify it, where the nerves are firing incorrectly, and the wrong nerves are firing too much, and the right nerves are firing not enough. Okay, acupuncture can help in some cases to kind of switch that around a bit and get things calmed down. So it can be useful.
Okay. We see a lot of advertisement. You can go to any drugstore. Costco's got shelves full of anti-inflammatory supplements. Do they work?
In some cases, they work great, and in other cases, they don't work as well.
Okay.
So that's variable.
What's the ingredient there? What's that supposed to do?
Well, boy, I don't have the pathway to show you biochemically.
Yeah.
But basically, when we think of anti-inflammatory medications, there's two large types. There's the steroids, prednisone, this type of thing, which are wonderful anti-inflammatories, and they decrease inflammation in a marked way. Unfortunately, long-term, and even sometimes short-term, they have a number of complications which we'd rather not enter into. Okay. So the other big group of anti-inflammatories is the non-steroidal, and that's what the public knows. That's what's on the shelves. That's the Tylenols, the Advils, the Aleve, the Naprosins, you know, that type of thing. And so they can be very useful in some cases. I think in some cases they might be overutilized. They also can have their share of side effects. Yeah. But yes, it's a useful avenue.
All right, because I think a lot of people, you know, they'll take myself, I'll take a couple of Advil or Tylenol or something to take away the chronic back pain sitting on these chairs 3 hours a day. Yeah. You know, but I'm always mindful of, geez, I don't want to get addicted to this stuff. It does help, but I can't help it in the long run. It doesn't.
You will never become addicted to anti-inflammatories. Prednisone is not an addictive medication. The non-steroidals are not addictive medications, so you'll never get addicted to them. Sometimes we do see there's two primary issues, among others, but two biggies is the anti-inflammatories, a number of them can cause ulcers or irritation of the stomach and that type of thing. And the second issue is kidneys. The anti-inflammatories can hurt the kidneys if there's some issues there.
When you're dealing with chronic pain, do you, and I know Ventana's pretty much exists to look at the whole person and everything that's going on there. Where do you, or do you use just ordinary supplements, vitamins? Is that part of your thinking?
You know, I haven't, let's broaden that question a little bit, perhaps. Okay. And let's suggest that where does good health fit in? Okay, so vitamins and supplements, you know, if you're deficient in those areas, that can improve good health. Exercise has been shown especially in chronic back pain, over and over and over again, exercise helps and is a mainstay of therapy. Of course, when you hurt, you don't want to exercise, but that's actually what you need to do. So in the bigger picture, general wellness and being fit and healthy can make a big difference. There are some folks who have implemented dietary changes. There are certain diets, certain types of foods that can be more inflammatory or more non-inflammatory, if you will. So sometimes dietary changes can be useful as well.
Okay. We're almost out of time, but can people get in to see you? A lot of doctors are scheduled pretty far out. How available are you these days?
I'm at this point, I have a number of openings on a regular basis. I've just moved from Klamath, actually, to Medford, and so in the startup process, oftentimes you have some openings.
All right, and let me just say to our viewers and listeners, to schedule an appointment with Dr. Heidinger, you can call 772-WELL or 772-9355 and schedule an appointment there at Ventana Wellness, the chronic pain specialist. And I just find this so interesting because, boy, I'm just amazed at how many people have a chronic leg, shoulder, back, or something. It almost seemed to be epidemic.
It's exceedingly common. You are correct.
All right, so you're there to take care of it.
We're there to help.
All right, and lastly, I just want to reemphasize here, Dr. Heidinger, and commend you again for dealing with the spiritual aspect, that you really feel led of the Lord to just kind of deal in those areas as well.
Well, I don't think we have time, but I could tell you a whole story of why I'm in medicine and where I am and why I've been led there. So yes, the brief answer is yes. I do think that we should be integrating the spiritual and that it can make a big difference in people's lives.
Well, I'm delighted to hear it because you just don't hear that very often, and it's one of those things that is refreshing, you know.
True.
To pray with your patients. What a thought.
Yeah, true.
Well, thanks for coming in. And again, let me just say to our listeners and viewers, if you want to make an appointment with him, he's new at the scene there at Ventana, and 772-9355 if you want to do that and schedule an appointment. Then they'll do all the normal things they do, but here's a guy that's also concerned about your heart and soul as well, so I really appreciate it. Dr. Heidinger, thank you. Keep up the good work. And
thank you.
Again, let me remind you folks, let me see how much time. Oh, I got a couple seconds here. Don't forget Tired and Wired. Check it out. Free event tomorrow night with Nisha Jackson from Ventana, and it's going to be at the Smullen Center at 6:30 tomorrow evening. So it's free. If you're tired and wired and you need help, go learn a lot. It's free information. Tomorrow, 6:30 at the Smullen Center. We'll see you next time on Focus Today.